There are really two take-home points for us from this study. The first is that despite mounting evidence that pre-hospital blood transfusion improves outcomes, the reality is that most patients transported by EMS in the United States will not have access to pre-hospital blood products. And so until that changes, it becomes so important to optimize pre-hospital crystalloid resuscitation in a heterogeneous trauma population and move away from a one-size-fits-all approach. The second is that we really made it our goal to identify a range of crystalloid, to acknowledge the heterogeneity in EMS and trauma systems across the U.S. so that those in more urban locations can target the lower end of the range, while those in more rural locations with higher transport times can target the higher end of the range. And so we used several different techniques to quantify the pre-hospital crystalloid volume that was associated with the lowest 24-hour mortality in a population of severely injured trauma patients at risk for hemorrhagic shock. What we ultimately found was that those patients who received between 250 and 1,250 cc's of pre-hospital crystalloid had lower mortality than those that received lower or higher volumes. When we specifically looked at patients with traumatic brain injury, we saw that the lower end of that range was shifted up to 500 cc's to prevent secondary brain injury. And finally, we also looked at some potential underlying mechanisms that might be driving our findings and saw that patients that received that moderate volume of crystalloid had greater endothelial integrity and a trend towards lower pro-inflammatory cytokines. We hope that you enjoy reading the full paper, and thank you for listening.